It's the first of its kind drug recovery program in the state of New Jersey. Next Step is aimed at combating drug addiction and reducing jail reentry for those struggling with substance abuse disorder. Today at the Monmouth County Correctional Institute, law enforcement and health officials joined together to announce this new program.
If someone comes into the county jail facility and is suffering from addiction, we're going to identify that person and we're going to link that person to necessary treatment in the hopes of providing for best practices clinical treatment such that that person will have the greatest opportunity for sobriety.
Last year in Ocean County and in Monmouth County, we experienced a significant drop in opioid-related deaths, which was just a start because we started to patch together a continuum of care.
If you think about what happened with Narcan deployment now over almost 3 years ago, when all our officers out in the community and Prosecutor Coronado and Prosecutor Riccione put forth Narcan deployment in the county. Well, what happened? We deployed Narcan, took them to the hospital, but there was nothing else medically wrong with them, so they would refuse treatment and walk out. Well, that was the gap, and so that gap was addressed in much the same way. So that services were brought to the hospital, like Lifeline, like Carrier Clinic, to those hospitals around the state of New Jersey, so that there is a recovery specialist or coach before they walk out of the hospital. No different here. You're arrested and you're about to be released on bail reform within 72 hours. Right? How do we get you the necessary services before you walk out of this facility? We have substance abuse services, counseling, and detox, all those services inside the facility. But with bail reform, they're not inside the facility anymore. They're being released within the 72-hour period and not captured and not offered those services.
Is this a surefire way with these treatment services in this program to make sure that these inmates don't reoffend?
We want to save lives. I mean, Ben, when you look at the statistics, the most vulnerable time for a person that's addicted is when they leave the facility. Why? Because either they've been detoxing for 30 days, 60 days, 90 days, or 3 days while they're awaiting their bail hearing. Whether it's 3 days or 30 days, they're leaving here with no services, going back out into the street, and potentially overdosing again, and certain death, right? And so that is part of our offering here, is to be sure that, one, we don't want to see them. We don't want to see the recidivism rate occur here in Monmouth County, but we don't, and the reoffending, we don't want to see that. But more so, we want to give them help and try to save their life.
What about some of the inmates that you offer this program or who are eligible to be a part of this refuse it, or there's some other circumstances?
We're leading the horse to water, but the truth is you can't make them drink. But that's why we employ the recovery specialists, because they are experts. They're subject matter experts on convincing that person, or at least taking the best shot at convincing that person with the support of family and friends and loved ones to take that treatment. But can we force them to do it? No, we can't. And what would happen is then we would just prosecute them in the traditional court process. They wouldn't get the possible benefit of the drug diversion program that we employ, and that could be a downgrade or maybe even a dismissal of charges. That's that stick and carrot mentality that we're trying to create with them, to give them added incentive beyond just their own health to try to enroll in the program.
Is there a way, while prosecuting these cases or when they reach court, to mandate somebody into treatment while they're in the Corrections Institute?
Well, there is no way to mandate it, but the leverage that we have over somebody who's arrested for a crime, it's pretty powerful. People don't want criminal records. They don't want to have to pay fines. They don't want to have to come to repeated court appearances. There's an incentive for everyone to keep their record clean and protect their finances. There are mandatory provisions that you could use at drug court, but people have to qualify for the drug court program, which is a statewide program.
This program is designed to help those struggling with the disease of addiction find recovery and find a new life. At the Monmouth County Correctional Institute in Freehold, Vin Ebenu, Town Square Media News.